Hi everyone, welcome to researchmd.com. Another great presentation today. All our presentations are very short. We want to make sure everything is done under 9 minutes, okay? So you should review it again. That's the best way to remember. There's no point in, again, I always tell, like, there's no point in watching like an hour-long presentation. You don't have time to review it on a faster basis. So at least 3-4 times you should review it so it stays in our brain. So the topic today is Piriformis syndrome. My name is Pramil. Cheriyath. I'm a program director in internal medicine residency, transitional residency. I teach medical students and residents on a regular basis. I'm also director of research, assistant professor of medicine, two major medical schools. Let's look at the anatomy of the piriformis muscle. We got a nice picture on the right side. Small triangular muscle in the gluteal region. Start from the lower spine, connect to the upper surface of each femur. It contracts to rotate the hip and turn the leg, foot outward. So you can see the sciatic nerve runs vertically directly beneath, and the nerve runs through the muscle. Remember that the sciatic nerve run through the muscle. Just if you can remember, like, look at the picture. It's like a triangular muscle in the gluteal region, and you got the sciatic nerve runs vertically, and it contracts to rotate the hip and turn the leg and foot outward. Okay, so what is piriformis syndrome? It's a condition in which the piriformis muscle spasm, okay, it goes into spasm and causes buttock pain. It irritates the nearby, we already said the sciatic nerve goes through it, nearby sciatic nerve, and cause pain, numbness, and tingling along the back of the leg into the foot where the distribution is, okay? So the female to male incidence ratio is like 6:1, so it's more in females, and patient with sciatica is like around 6%. So what are the risk factors? When you look at the risk factors, like if you're greater than age 40, women, we already said high risk, history of trauma to the hip, thigh, or buttocks, and bulging disc or other spinal issues, repetitive activities such as running, sitting, or a sedentary lifestyle, poor diet include high inflammatory food, overweight, anatomical abnormalities, and skiers, truck drivers, tennis players, and long distance bike. All of these people are the risk for piriformis syndrome. So what are the clinical features and symptoms? We already said, like dull ache in the buttock and the low back, pain down back in the thigh, cough in the foot. That's where the distribution of the sciatic nerve. Pain when walking upstairs or inclines. Increased pain after prolonged sitting. Reduced range of motion at the hip joint, okay? And then pain often becomes worse after prolonged sitting, walking, or running. And it could feel better after lying down on the back. So the signs, if you test that there's a tenderness in the gluteal region, and then you reproduce the pain by flexion, abduction, and internal rotation of the hip, okay? So you reproduce the pain by flexion, adduction, internal rotation at the hip. Weakness can be observed with the resisted external rotation and abduction of the hip also. So you got a nice picture of the pain distribution, where it goes. And the difference, like, I mean, you have to know the main difference is like piriformis syndrome and sciatica. Okay, let's look at what is the major difference in the sciatica. You got buttock and hip pain is typically more common than the lower back pain, and the sciatica leg pain usually greater than the lower back pain, and the pain may radiate into your toes where the distribution is, and the affected leg may feel heavy. So it's good to know the difference between piriformis and sciatica. So how do you diagnose it? You know, there's some signs always when you look at an orthopedic condition. Or the first one is the Lesague sign. Pain present in the vicinity of the greater sciatic notch during extension of the knee with the hip flex to the 90 degrees, or tenderness to palpation to the greater sciatic notch. Okay. Then the other sign is the pace sign. So what is the pace sign? You got pain and weakness are present, resistance, abduction, and external rotation of the thigh. And then you got Freiberg sign. Pain occurs with the passive internal rotation of the extended thigh when the patient is supine. So you look at the sensitivity and specificity. You got Lesague sign, you got 80 to 97% sensitivity, but specificity is low. But a good test probably like a pace sign. So 88% and 83% respectively. So remember, three signs: Lesague sign, pace sign, and Freiberg signs. If I remember one, I always remember the pace sign, which has highest sensitivity and specificity. Okay, if you're writing an exam questionnaire, they're going to say this pain and weakness in the present on the resisted abduction, external rotation of the thigh. So what do? Imaging studies, like You can do like CT scan to identify if there's like spinal stenosis or arthritic changes, and then pretty much you're doing all this to rule out other causes. Okay, don't jump into doing all the studies. I mean, if you cannot find all the, I mean, on examination, then to rule out other causes, you do the studies. EMG can also be performed to determine neurological or muscular changes. In piriformis syndrome, abnormal patterns are found in the gluteus maximus piriform muscles. And so just don't jump into imaging studies like right away. So more like a physical diagnosis with the history taking and all that. Treatment, anti-inflammatory drug. Just be careful the patient have like kidney failure or gastric ulcer and all that too. Soft tissue massage to gluteal and the lumbosacral regions may help to decrease the tightness of the affected musculature. Gradual stretching of the piriformis, iliopsoas, tensor fascia, lata, hamstrings and gluteal muscles. Core packs and occasionally electrical stimulation are applied. And after exercise or manual therapy, rest from offending activities and initiate physical therapy, moist seat or ultrasound. And then you got myofascial release technique for the piriform muscle as well. So these are the treatment options. Profession that involve prolonged sitting can worsen symptoms of piriform syndrome, and the patient should avoid sitting for a longer period, which should be like instructors stand and walk every 20 minutes. Okay. Thank you so much for watching. We'll be back with another presentation. Please subscribe to our channel. Thank you.